Hello, my name is Alexis Gardner and I will be discussing angiograms. An angiogram is an imaging technique that shows blood flow inside of the blood vessels and organs. The images look for blockages in the blood vessels. The patient is normally sedated for an angiogram, but anesthesia can be used for patients with higher anxiety. The catheter is inserted into an artery and a small amount of dye is released into the blood vessels. The three most common arteries used are the femoral, radial, and brachial. An angiogram can take anywhere between 15 minutes and 2 hours to complete. Once the test is over, the catheter will be removed. Pressure will be applied to the puncture site for 15 minutes. A vascular closure device can be used to close the puncture site, and there is a short recovery time. Patients normally leave the hospital the same day as they receive the procedure. Depending on the body part being examined, different specialties may perform the angiogram. Interventional radiologists can perform various types of angiograms using CTA. Vascular surgeons typically perform peripheral angiograms, which helps to visualize the veins in the legs and arms. Interventional cardiologists perform coronary angiograms to visualize arteries in and around the heart. Interventional neurologists perform cerebral angiograms to visualize the blood vessels in the brain. Support staff for an angiogram can include scrub nurses or technologists who assist with sterile and catheterization procedures, and a radiologic technologist. Depending on the department's protocol, additional nurses, technologists, and hemodynamic technologists may assist in the procedure. These are a few images of coronary, cerebral, renal, and pulmonary angiograms. An angiogram system can range from $750,000 to $1 million. It uses a conversion fluoroscopy imaging system, which converts electrical signal into digital signals. It has an island-type table with four-way floating capability to provide easy access to the patient from all sides. It has a specialized X-ray tube with high heat load capability and an electromagnetic injector to control the flow of contrast media being pushed through the blood vessels. The monitoring equipment watches the oxygen level, the pulse, and the pressure of the veins and arteries as the contrast media flows through. This is an image of the equipment used for an angiogram. Diagnosis of angiogram include blood clots, which are semi-solid masses of blood and other substances that form in the blood vessels. Aneurysms, which is a ballooning or weakening of the artery that can occur in the aorta, brain, intestine, spleen, or back of the knees. This can result in internal bleeding, stroke, or death. Coronary artery disease, which is damage or disease in the heart's major blood vessels, usually caused by a buildup of plaque, causing the arteries to narrow, limiting blood flow to the heart. Atherosclerosis is a buildup of fat and cholesterol and other substances in the artery wall, causing obstruction of blood flow. This often has no symptoms until the plaque ruptures, causing extreme blockage. Today, many catheter angiographic studies have been replaced by less invasive methods such as computed tomography angiograms, or CTAs. They do not require catheters to be inserted but still use contrast. There's also a magnetic resonance angiogram, or MRA, which avoids contrast and does not require a catheter to be inserted.